The government has confirmed a new COVID variant that has been found in India. So far we know of the UK, South Africa, Brazil variant. Now we also have an Indian variant which has been found in Maharashtra, Andhra Pradesh, Kerala and Telangana. But before we proceed any further, I want you to take a look at this. This is a map which sequences the progress of the R factor in various countries, India, France, Brazil, Russia, as well as the United States. Now, it may appear as these are some jumbled up lines, but what these lines represent is each country and the R factor. For the benefit of our viewers, what is an R factor? R factor means the probability of one person infecting the other. So if the R factor is more than 1, that means that one person is infecting more than one person, and that's an extremely undesirable situation because then the trajectory only moves up. If the R factor is below 1, that basically means that one person is infecting fewer people and thus COVID is under control. So we have taken a time frame. This time frame is from October 2020 till March 22nd, 2021, and we'll show you what actually happens to the R factor. So that's India, by the way. Very, very low R factor, the lowest. Then France drops, India is second last, India then again becomes the last, which is very good. But suddenly, somewhere in February, you see this Indian line going up, 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 up and continuously moving up. I don't know if you can see this line or not. This little green snake, the green line over here is India's R factor as opposed to France, Brazil, Russia as well as the United States. So from the bottom of this scale to the topmost and rising really fast, really steep. Now this is an undesirable situation, and if this continues, it could be a big reason for us to worry. What do experts feel about this, and could this be a result of the new variant that the government has told us about? We have two very special guests today who perhaps know all the answers. We have Dr. Randeep Guleria, the Director of the All India Institute of Medical Sciences with us. Also, it's a pleasure to have Dr. Naresh Trehan, Chairman and Managing Director of Medanta, the Medicity. Thank you very much, doctors. I'll first begin with you, Dr. Guleria. You see that this R factor is now rising, which is a cause of worry. I mean, you've come on various programs in the past to say that this is a reason for us to worry if we see this factor rising, which means the virus is spreading and increasing. Can you tell our viewers about this new variant and how much that really is the contributor?
So as we move forward, we know that the COVID will have mutations and there will be new variants coming up. Our concern has always been what we call variants of concern. That is a variant which has clinical consequence. That is, either that variant is one which causes more cases, it's more infectious, it's a variant which causes more mortality, it's more lethal, or it's a variant which has an immune escape mechanism so that people who have already got COVID-19 have a high chance of reinfection, or those who have been vaccinated are not protected adequately even after being vaccinated. Currently, the concern is that the mutation that have been reported in India, the bulk of it, of course, is the UK variant, which has been seen by the genomic sequencing, the network which India has in the consortium which looks at this. But they've also picked up some variants which are the South African variant, and they've also seen some mutation which are the double mutations occurring. But whether this is a cause of the rise in cases is something that has to be established.
Correct.
You have to be able to show that where your increasing number of cases are happening, there these variants are actually increasing exponentially. So I think that data still has not come out as far as the database that I could see. But it can be one factor which could be contributing to the increasing number of cases. But I would still like to say that even if we have variants, if we were to have good COVID appropriate behavior, we could still prevent the spread of variants, because that would also be sort of halted if you were to wear a mask, have physical distancing and avoid crowded places.
Absolutely. Dr. Trehan, you know, a lot of people are now concerned ever since this conversation of an Indian variant has come about, a double mutant, if you were. People are basically concerned on these 3 or 4 broad points. What is the difference between this version and the version that we had earlier of COVID-19? Are our vaccines, and this is a very pertinent question, are our existing vaccines good enough to sustain or ward off this new variant?
So first of all, it's not a surprise that we have discovered variants of our own in India which are not related to the ones imported from UK or Brazil or South Africa. And the fact is that these variants, whether they are responsible for the rapid spread that we are seeing right now, the rising numbers which are exponentially even higher pace and during the first wave, we should now not let our guard down, and we should wait for the data to establish whether it is truly the case that this variant is participating in the rapid spread or not. That's very important. So we should stop speculating right now, because we knew very well these things will happen. And if you remember, and we have Dr. Guleria on the screen also, that we have been saying day in and day out, look, the virus has not gone away. We know that the virus will mutate. We know that in this connected world, many viruses will exchange continents. Knowing all that, we knew that there was only one defense which everybody can do. So it doesn't depend on the government, it doesn't depend on the laboratories, it doesn't depend on the scientists and the manufacturers, it depends on you. So the whole idea is you become the center point of this defense, that moving forward. Now, all the adjuvant stuff that we have, vaccines, better treatment, less mortality, all those things are very nice, but they still don't take away from the fact that COVID appropriate behavior is our only savior.
Correct.
We need to again get back into responsibility. We are not saying lockdown. We are saying just individually lock your mind up around the fact that there are 3 mantras to follow. I mean, we've gone blue in the face for over a year. We've been saying it. Please do not let your guard down. There's no need to have large weddings. There's no need to have celebrations which are more than 50 people. And in an enclosed space, you know that you're going to have a problem. This is no surprise. There are so many weddings that we hear about now that people actually violated every rule.
Correct.
And then 30% of the people that attended the wedding are now COVID positive. This is the interesting thing that we are noticing, that the spread is now in the middle and upper middle class. And they are the ones who are celebrating. I don't know whether the clusters have already, it's gone through and they've developed immunity. That's possible. But I'm telling you that this is worrisome. Good thing the government has accelerated the vaccine program, because the vaccine does, if nothing else, it prevents severe disease and prevents mortality.
Correct.
So I think the benefits are clear.
Correct.
And we need to pay attention ASAP.
Okay, Dr. Guleria, quickly coming back to, this point on vaccination, I also read in the context of this Indian variant and the double mutant, the words which have also been used by you of immune escape. Now, can you, for the benefit of our viewers, tell us whether this immune escape means that people who already have the virus and self-developed antibodies are also potentially at risk, or also those people who have antibodies because of the vaccine are also potentially at risk?
So we're looking at both strategies. One is developing an immune escape. That is, you got the infection, you have antibodies, but your antibodies have waned over a period of time. And now they're not strong enough, and you have a new strain which is the antibodies cannot really build a good response, and therefore you can get what we call reinfection. As far as the vaccine is concerned, the vaccine gives a more robust antibody response, and therefore normally what one would say is that if you have been vaccinated, you are definitely protected from severe infection in terms of having to go to hospital or dying because of COVID. But your immune response may come down to some extent. So if we say the efficacy of a vaccine was, let's say, 80%, it may come down to 60%. And that means you may still get a mild infection, but your immune system may still be able to control it.
Okay.
Now, if you remember, the WHO cutoff was that you must have an efficacy of at least 50%. Most of the vaccines that we have are way above that. So if there is a slight decrease in the efficacy, it is still acceptable. The concern that we have is that as we move forward and as these variants further change, we will have to look at, do we need to really tweak our vaccines as we move forward so that they cover for these variants? And that is a possibility which we will have to consider.
Could
As
you
of now,
elaborate,
we
Dr.
don't really
Guleria?
need to
When
do
you
that.
say tweaking of vaccines, what do you mean?
When we say tweaking of vaccines, we do this every year for our influenza vaccine. Every year we give a flu shot which is slightly different from the year before, depending upon what we call the circulating strain. So you could tweak your vaccine so that it now covers for the variant also. In terms of the type of vaccine that you're making, the antigen that you're preparing will cover for the variant also, and therefore gives antibodies which also protect you against the variants. And there is a lot of research going on to look at whether you could develop a vaccine which could even cover for subsequent variants using what is known as computational science and other scientific database, so as to be able to provide more widespread cover even for future mutants which may develop.
Correct. Dr. Trehan, quickly coming back to you on the point of vaccines. See, of course, that one point has been made loud and clear by both of you gentlemen, that the best way to prevent this is COVID appropriate behavior. That message has gone across loud and clear from the both of you. But Dr. Trehan, on the vaccine front, do you feel that it is now time for the government to perhaps consider some more vaccine candidates? I mean, the more vaccines we'll have, the better the chance to save people.
So of course, but you have to wait for the data to prove safety and efficacy before you can approve even for emergency use. So now you've heard again and again that Sputnik is possibly on the anvil, and it probably will get approved because they say unofficially the data is quite robust and it has been used in zillions of doses around the world. So there is every possibility that Sputnik will also come to the market very quickly. Now, the basic thing is that the government is trying to match the supply of vaccine with opening up the the sector for saying what age group, what phase, which segment to open. The point now is that we know that around 50% of the people who are eligible in that segment are actually getting the vaccine. The second thing that's happened is that we have extended the guidelines. The government has extended from 4 weeks to 6 to 8 weeks. So I think that panic of shortage of vaccine is waning now, and we should aggressively open up as many sectors as possible and let people get the vaccine, the ones who are ready, those who don't have the hesitancy. And as numbers grow, the confidence will also grow and more people would like to get it. Now, this hesitancy is not only peculiar to India, it is all over the world. There was a big report yesterday only, I think your channel gave it, about what percentage is actually accepting it. So I think there is enough vaccine. I think there are enough people who want it. And I think the more we can vaccinate, the better off we'll be in the long run.
Okay. Dr. Guleria, my final question to you. Again, reiterating the point that both of you have made, that COVID appropriate behavior is the thing that is going to save a majority of people, that has the maximum efficacy, if you were, in place of any other vaccine. But, when vaccines are made, Dr. Guleria, and knowing that these viruses tend to mutate, don't vaccine candidates factor this in, that there will be mutations?
No, they factor it in, but you can't predict what the mutation is going to be like. No. So you will have to only be able to factor that in or change the virus, the vaccine, depending on how the mutation evolves. One cannot predict what mutation will happen. And that is not only true for this virus, it's also true for the influenza virus. If we knew every year which is the mutation that's going to happen, we could stockpile the vaccine much in advance. We're not able to do that because of the fact that we are not able to predict how the virus will mutate, in which direction it will go. And that is what is happening as far as COVID is also concerned. Therefore, we will have to go along the path as mutations occur, we develop vaccines also to take care of that mutation.
All right. Dr. Guleria as well as Dr. Trehan, thank you very much for joining us on this broadcast.
Thank you.